Abnormal breath sounds. Breath sounds are produced by vibrations of the vocal cords due to turbulent flow of air. Normal breath sounds are classified as bronchial, vesicular, or bronchovesicular. Abnormal breath sounds refer to sounds that are heard in addition to the expected breath sounds. The most commonly heard added sounds include crackles, rhonchi, wheezes, stridor, and rubs. Crackles. Crackles are non-musical, interrupted, added sounds of short duration. They are generated by small airways snapping open on inspiration. Therefore, they are predominantly inspiratory. They are explosive in nature. Types of crackles. Fine crackles. They are less loud, short in duration, and arise from the alveoli. Coarse crackles. They are low-pitched, loud, and arise from the bronchus and bronchioles. Significance. Crackles frequently occur in interstitial lung disease, pulmonary edema from heart failure and infection. Late and high-pitched crackles often represent interstitial lung disease, whereas early and low-pitched crackles tend more towards chronic obstructive lung disease. Expiratory crackles occur in chronic bronchitis and pulmonary edema. Rhonchi. They are musical, continuous added sounds. They may be low-pitched, sonorous, arising from large airways, or high-pitched, sibilant, arising from small airways. Wheezes are musical sounds caused by air movement through constricted small airways, such as bronchioles. Types of wheeze. Fixed monophonic wheeze. Random monophonic wheeze. Expiratory polyphonic wheeze, and sequential inspiratory wheeze. Fixed monophonic wheeze is a single note of constant pitch, timing, and sight. It results from air passing through a localized narrowing of the airway. It is seen in incomplete obstruction of principal or lobar bronchus, as in tumors, foreign body, bronchial stenosis, and intrabronchial granuloma. Random monophonic wheeze is a random single note, which is scattered, occurring in inspiration and expiration and varying in duration, sight, and pitch. They are present in bronchial asthma. Expiratory polyphonic wheeze is a complex musical sound of multiple notes, with all its components starting together, continuing to finally end in expiration due to expiratory compression of large central airways. These may be seen in emphysema. Sequential inspiratory wheeze is due to the opening of distal airways, which has become abnormally opposed during previous expiration. These occur in pulmonary fibrosis, fibrosing alveolitis, asbestosis. Stridor is a high-pitched sound originating from the upper airway and occurring on inspiration. It is distinguished from other sounds by its intensity in the neck, more so than the chest, timing, inspiratory, and pitch, high. Types of stridor. Laryngeal stridor is a high-pitched, crowing sound better heard during inspiration, in obstruction of the larynx, by foreign body, laryngeal edema. Tracheal stridor is a low-pitched sound, best heard in inspiration. A rub is a grating sound, coming from inflamed pleura, rubbing against one another. It is usually louder than other lung sounds, due to its generation closer to the chest wall. Rubs usually occur during both inspiration and expiration, at a mirrored point in the respiratory cycle. Rubs are most often confused with crackles, but are distinguished by the rub's biphasic, localized quality, often with overlying point pain, on the chest wall. To get more such high-yield medical content, don't forget to subscribe. Visitiamed. The easiest and fastest way to take advanced clinical history.